The biggest lie I've heard in 30 years of practice is that herniated disc automatically means surgery, and it doesn't. In fact, I've had patients come into my office terrified because they were told, your disc is blown and you need surgery. But here's what shocked them. Some of those patients never had surgery. So what changed? A bulging or herniated disc isn't always the problem. The real problem is often the pressure irritating the nerve. When that pressure is reduced, many people experience significant improvement in pain or numbness or sciatica without surgery. I had the same thing. I had multiple herniated discs. I was able to do a specific therapy that stopped the pain and got me better. Now, every case is different and not everyone is a candidate, but surgery is often not the first and only option. I remember one patient who came in barely able to stand because of severe sciatica. They were convinced that surgery was inevitable. They were surprised to learn there were conservative treatments and other options that were available to try first. That's why getting the right diagnosis matters. But here's the crazy part. I've seen people with terrible looking MRIs who had almost no pain, and other people with nearly perfect MRIs who could barely walk. How is that possible? I'll explain that in the next episode. Follow this series if you're dealing with a bulging disc, a herniated disc, degeneration of your disc, or even sciatic pain. It could completely change the way you think about your back.